Welcome to the deep dive. Today, we're stepping into a really complex and sensitive area. We're looking at that point where cultural practices intersect with, well, global human rights and health. Specifically, we're going to unpack female genital mutilation cutting, FGMC. Our mission for you today is to explore its impacts, but also, maybe surprisingly, some pathways toward ending it. We're drawing on a review looking at clinical anatomy and these alternative rights. Okay, so let's just start there. For anyone needing a refresher, what exactly is FGMC? How's it defined?
Right. So the WHO, the World Health Organization, defines it pretty clearly. It's any procedure that involves partial or total removal of the external female genitalia, or, crucially, any other injury to the female genital organs for non-medical reasons. And framing it as a human rights violation is key, globally.
It sets a standard, doesn't it?
Exactly. It provides that universal framework.
Yeah.
And the scale. Honestly, it's quite staggering. We're talking over 200 million women and girls alive today who've undergone it.
200 million, wow.
And around 3 million girls are estimated to be at risk every single year. It's concentrated, in about 30 countries, Africa, Asia, the Middle East. But, importantly, we're seeing it more in developed countries, too, because of migration.
So it's becoming a global health issue in that sense.
Absolutely. It's no longer confined to specific regions.
Now, a common misconception might be that this is tied to religion, but the sources stress it's primarily cultural. Why is that distinction so important?
That's a really critical point, because if you understand it's cultural, not religious dogma, you realize you're dealing with deep social norms. Things like belonging, social acceptance, marriageability. It's woven into the community fabric.
And often seen as women's business.
Yes, which can sometimes make it harder for, say, men in the community or external groups to even start a conversation about change. And there are different forms, which is also important. The WHO has 4 main types. Type 3, infibulation, is probably the most severe. It involves narrowing the vaginal opening.
Which needs reversal, right? For health or childbirth.
Often, yes. It requires de-infibulation for intercourse, childbirth, and sometimes just basic health needs.
And type 5 is interesting. It's a bit of a catch-all for other harmful procedures. And the source makes a pretty provocative link here to female genital cosmetic surgery.
It does, and it's a comparison that definitely makes you pause. The argument is that many of these cosmetic procedures, often sold as enhancements, don't have solid evidence for safety or effectiveness. And anatomically, some of them look quite similar to certain types of FGMC.
So the concern is?
The concern is, well, could these practices inadvertently normalize altering female genitalia for non-medical reasons? Even if the stated intention is different, it's a difficult question. And connecting back to the consequences of FGMC itself, they are severe. Immediately, you've got risk like intense pain, bleeding, infection, even death in some cases.
Awful. And long-term.
Long-term, women can face chronic pain, serious urinary problems, sexual dysfunction, infertility, and then there's the psychological impact.
Which must be immense.
Profound. Feelings of shock, humiliation, shame, especially, when encountering different cultural norms around bodies, maybe in healthcare settings in a new country, it adds another layer of trauma.
Okay, so given all that, how do we actually work towards ending this? The sources point to social pressure as a major barrier. What does that really mean?
It means there's often intense pressure within communities. Fear of being shamed, fear of social exclusion, the belief that an uncut girl won't be marriageable.
These aren't just abstract ideas, then. They're real social consequences.
Very real. They shape a girl's entire life and standing. But here's where there's hope. Alternative Rites of Passage, or ARPs, are showing real promise.
Okay, tell us about those.
So ARPs basically allow communities to keep the celebration, the public recognition of a girl becoming a woman, which is culturally important. But crucially, they do it without the cutting. Instead, the focus is on education, family life, women's roles, sexual and reproductive health.
That sounds powerful. Replacing the harmful part but keeping the positive cultural framework.
Exactly. It respects the tradition while protecting the girls.
And there's examples of this working, right? Like in Kenya.
Yes, definitely. Amref Health Africa's work with Maasai elders in Kenya is a great example. Over 8,000 girls went through ARPs instead of FGMC.
That's incredible progress.
It really is. And the source even mentions, kind of as a last resort if education isn't quite enough, the idea of a symbolic prick, but on the mons pubis, not the genitals. It shows how communities are finding ways.
Finding culturally sensitive ways forward.
And another really key piece is involving men. Often, they're left out of these discussions because it's seen as women's business, remember?
Right.
But men are crucial. They're often decision makers, partners, fathers. Getting them involved, countering false beliefs like the idea that infibulation increases male pleasure, which isn't true, is vital for change to stick.
So it needs to be a whole community approach.
Yep.
So this deep dive really shows FGMC as, well, incredibly complex, deep cultural roots, but undeniably a violation of human rights. But, and this is important, it also shows real, tangible progress is possible through things like these alternative rites of passage, through culturally smart interventions, and bringing everyone, including men, into the conversation. It leaves you thinking, doesn't it? If these community-led, culturally sensitive approaches can work for something as deeply ingrained as FGMC, what other harmful social norms around the world could we maybe tackle using similar strategies? Something for you to consider.